Hello, and welcome to How to Integrate Telehealth to Improve Your Patient Experience and Optimize Your Behavioral Health Practice. Next slide, please. I'm Stewart Gandolf. I'm CEO of Healthcare Success. I will be co-hosting today and leading through our content. And I'd like to welcome to JD McFarland, my esteemed guest, or I guess co-host rather, and he's solution architect for Mend. Welcome, JD.
Hi, Stuart. Thank you very much for having me here today.
JD is always good. I think this will be a fun and informative meeting for us and hopefully for you. So without further ado, let's go ahead and talk about the agenda, what we're going to cover today. So we're going to start off talking about a little bit about telehealth and what's going on with telehealth. I'll give you a quick update on some of the things that we're seeing out there. I think there may be some things that may seem like common sense and some surprises to you as well. We're going to talk about also, I've been working in and around healthcare for over 20 years, and as well as JD has been for a long time. So there's some common behavioral health objectives that people we talk to express all the time. So we'll cover those to make sure we're all on the same page. And then JD is going to be covering the meat of the presentation, talking about some of the very specific strategies that you can use to improve your practice and optimize patient experience. We'll talk about what we think is one of the keys to telehealth success, and then we will open it up for Q&A. So on that note, feel free to chat us along as questions occur to you. What we're going to do is probably cover the Q&A around 45 minutes into the webinar, and so we probably want to address them directly live because we have our want to stay on track. But make sure you do feel free to ask questions as they come up. If you have technical questions or things that we can handle, we do have someone in the background who can do chats about connectivity or getting people in or whatever. So feel free to chat throughout the session, and then we will cover all the questions that we can at the end of the presentation and follow up with additional questions afterwards if we don't have time. Another thing that's really important at this stage is to let you know that yes, this telehealth webinar will be recorded. We will be sending out recordings to participants and people who registered afterwards. Feel free to share it with everyone you know, and because we think it's going to be a really helpful and productive webinar today. Okay, so let's get into it. Let's talk about some of the, talk about an update. What's going on out there? So what's really intriguing, and I've spoke for those of you that have seen me speak before, or probably seen JD speak, but I know for sure for me, I talk about telehealth a lot. And in fact, I was a bit of an early adopter with telehealth. I've been, as a patient, I've been using telehealth now for probably 3 or 4 years, but I was pretty rare bird back in the day. And so pre-pandemic, 2/3 of Americans were, more than 2/3, said they felt hesitant or doubtful about the quality of telemedicine. So this is just before the pandemic started. And now 87, actually 89%, want to continue using telehealth for non-urgent consultations after COVID has passed. So that's a really important thing there, to know that this is not a flash in the pan, that consumers overwhelmingly want telehealth. Next slide. What we find is, it also, I thought of note here that was interesting, that in the world of behavioral health, psychiatry, psychology, is the number one most used case. In other words, mental health we see across the board, and JD, actually, you can expand upon this in a moment, but the data I have here was for medical specialists, so it was psychiatry and substance use disorder. So obviously, this is not covering psychologists and LCSWs and MFCCs and all the other variations. But still, this is very indicative of what's going on out there. By far, mental health for some of these medical claims is the leading factor. JD, what is your experience with behavioral health, mental health, in terms of usage for telehealth? Do you agree?
Oh, definitely. And over 65% of our customer base is in behavioral health. And as you mentioned, it's across all different subspecialties. We have groups using it for medication-assisted treatment. We have people using it for intensive outpatient treatment, long-term therapy, family therapy, play therapy with children, to geriatric specific lines of services. So it can cover the whole gamut.
All right, totally makes sense. Okay, next slide. Now, another thing here that's really important again, and JD, I'd love to get your input on this after I go through this. Again, we talked about, pre-pandemic versus post-pandemic, right? And so we're still, I guess, I don't know when post-pandemic will be. We're still in pandemic, but the pre-pandemic, you can see where telehealth usage was. It was a trickle, and again, I told you I was an early adopter to this whole thing. And what my experience was that, there was a lot of friction, a lot of barriers. So number one, there was concern about the patients, but a lot of the times when I was working with providers, the issues were more internal. They were concerned about, rightly so, HIPAA issues and concerns. They were concerned about reimbursement, and they were concerned about their own providers accepting it. So I don't know if the conversation ever even made it to what the patients think. It was really more like, we just can't do it. And so, but what was interesting is, as soon as the pandemic hit, it just rocketed. I mean, beyond anything I could have imagined previously. And suddenly now, there were health systems and hospitals that weren't doing any telehealth at all, that suddenly were doing tens of thousands of cases by telehealth a week, when the government opened it up and allowed you to get reimbursement and allowed you, them to do a short-term solution regarding the HIPAA issues. So that's changing, and JD can speak about the HIPAA stuff later and the reimbursement if that's appropriate. But today's focus, we're just talking about how to use this. But you can see the graph here. It went from 0 to hero, right? From 0 to almost 80% usage. And then it stabilized. And one of the things that we talk about now is the fact that a lot of people say, oh, well, telehealth's over. And it's like, well, no. If you look back to where it was essentially at 0 market share, and now it's 38 times and more used. And it's again in behavioral and mental health, it's used very, very extensively. JD, any extra comments on this?
Only that if you actually move that chart back about 10 years, you would see that it was a trickle that whole time. So it's not new. Like you said, we've been working in telehealth for a couple decades now. And really the combination of regulatory changes and the dramatic need both on the side of providers and patients around COVID really changed the paradigm. And now that people have used it, they want to keep using it. Providers in many cases have optimized their practices around it. And at a minimum, what I think most specialties, and particularly behavioral health, are going to see is a hybrid model going forward. And I think we're going to see that the current levels maybe go up a little bit, maybe go down a little bit, but we're never going to go back down to prior February of 2020.
And that's really a common thing that we can talk about again today as we go into it. Like, what do consumers want? We talked earlier a moment ago about the provider perspective of, in fact, let's switch to the next slide over here. I think it's coming up. Yep. So, we've talked about providers and what they want. And you can see here from our slide here that, there's some kind of credible associations here. We have the MA and then the Cleveland Clinic. But providers told that they were 2/3 or more than 2/3 said they were personally motivated to increase use of telehealth in their practice. Physicians agreed with the behavioral health professionals that they want to use it for chronic disease management, meds, care coordination. And almost 80% agreed that, patient scheduling, cancellation, reschedule capabilities were a good idea. But let's look at it from the patient's point of view. 80%, again, felt like virtual visits were as good as by a clinician. 91% said that made it easy to get the care they needed. 93% said the virtual visit clinician was interested in them as a person. And 95% said they felt comfortable using the technology. So those are huge, huge numbers. And JD, some of the experience you've had, and we've talked on a previous webinar about the patients sometimes even like telehealth more. Any other quick comments on that before we dive in?
You broke up for a second, but I think I know where you're headed. Basically, patients possible. They want to continue to get top-notch care. They want it to be as simple as the rest of their lives that they're experiencing as a consumer in the 21st century. Can they quickly and easily get an appointment? Can they reschedule that very easily? Are they going to have to come into the office? I mean, as crazy as that sounds, that's not that is no longer the norm. And if they've got an alternative provider who can get them seen in, say, 24 hours for a medication refill, and the brick and mortar doctor they've been seeing for the past 10 years is going to take 2 weeks to get them in, they're going to start making their medical decisions based on what's easiest for them.
Very good. Okay, next slide, please. So some of the objectives, next slide. So these are some of the objectives I mentioned earlier. I've been doing this for a long time. And I would say that some of these objectives become more important as behavioral health changes. So one of the things that, always, in whether really any healthcare profession and specialty, people are in there because they do care about patient outcomes, right? So positive patient outcomes are always a priority, always have been, and always will be. One of the things we see now that's happening, a lot more emphasis now that it's no longer, a sea of individual private practitioners, and that we have groups, mega groups, big institutions working together. The whole idea of streamlining operations and scaling are vital. We see this in general, whether it's doctor owned, whether it's a health system, whether it's a private equity based group, but the streamlining and scaling are vital. Cost reduction is important. Provider burnout, this has been an incredibly stressful time at every level of healthcare. I was at a social event outside, of course, socially distanced, on Saturday night, and we had a couple of healthcare providers there that are friends of ours, and they were talking about just the massive burnout that they're feeling right now. The on the ground providers that are working with emergency rooms and COVID, and but really everybody. It's been a really tough time. And today, particularly with younger generations, do care about quality of life a lot, maybe more than previous generations did. So provider burnout is probably at all-time highs under COVID, and it matters more to people these days. And so it's really important to think about that, not only from a retention standpoint, but just from being a good employer point of view. How do we reduce employee burnout? How can we increase daily visits and fill holes in our schedule? How can we make things more accessible to patients? And in behavioral health, particularly with federal government funded and public funded insurances, how do we automate paperwork? How do we make our life easier? JD, any additional thoughts on this one?
Yeah, and once again, breaking up on me a little bit. Not sure if it's my internet or what's going on, but a lot of these are related. So improving access to care, that's going to get more patients in the door. That obviously is going to help the financial bottom line of the practice. But at the same time, opening up care to more patients, making it easier for them to get in, that's going to help underserved groups, people in rural areas, working parents who may not be able to get off of work during normal hours, certainly can't take off time to drive across town, pick up their kid at school. Lots and lots of opportunities to really improve care and benefit the bottom line.
Excellent. Okay, next slide, please. So I guess the big question comes up, hey, Stuart, can technology really help with all those objectives? That was a pretty meaty list. And the answer is yes, we can help. And that's really the solution that we would argue is an integrated telehealth platform can help you optimize both your in-person and virtual visits. So I'm going to turn the ball over to JD to lead us through this next section. So JD?
Yeah, sure. Can we go ahead and have the next slide? We're just going to go through these. And FYI, everyone, it looks like my internet is the problem. So hopefully I've turned off my video, and hopefully we'll be good to go from here. So strategy number one, it's our lead. It's right in the title of this webinar, and that's integrate your EHR with telehealth. So many of the things we're going to talk about today work much, much better by integrating. And it all comes down to eliminating manual processes, eliminating opportunities for people to forget about things, enter information incorrectly, and ultimately multiplying the power of your workforce, both the providers and the support staff around them to make everything happening, or to make everything happen. And we'll go into that more in the next points. Next slide, please. Embrace self-scheduling and rescheduling. So this is a soapbox of mine. On the sales side, it comes up on almost every sales call, and the conversation goes two different ways. On one hand, we have customers who are saying we desperately need self-scheduling. On the other hand, we have patients who say, we want to make sure your platform doesn't do self-scheduling. We don't want it. We're terrified of it, frankly. They've tried it before, it hasn't worked well, or they have so many complexities in their organization that they're just really afraid of opening it up. And the benefits of self-scheduling are huge. We've got a couple bullet points here, but as I mentioned earlier, everything comes down to simplicity for the client. In fact, I'll give you an example. Right now, during this webinar, I was actually supposed to be at my 6-month checkup with my physician. Being a typical customer, I had completely forgotten about this because it was scheduled 6 months ago, and they asked me about, hey, this date in August, how does that work for you? Yeah, fine, whatever. Well, I got the notification this weekend, and I was able to actually let them know I want to reschedule. Their system wouldn't let me book my follow-up, but they gave me a call, and that avoided a no-show, let them backfill their time, and hopefully they've got productive time and they're making money off of this time. As a customer, it made my life easier. I now have an appointment scheduled for next week, which I will not forget about because a week is within my horizon of things I can think about. And I'm going to get the care I need. They're going to get their revenue. Their productivity is going to keep working. What we need from a technology standpoint to really make the most of this for providers is a solution with what I call guardrails. So patients need to be given the self-scheduling options that you want them to have with the logic that your business has, your business rules around scheduling. Are you only going to allow them to schedule with existing providers? What about certain appointment types, certain conditions? Say, if someone says they have chest pains, you want them to go to the ER. Is the scheduling system smart enough to know that and direct them in the right place? Is it customizable enough to accommodate these needs? So these are the kinds of things to think about. The technology exists. Adopting self-scheduling and rescheduling are much lower than they used to be. So you're right to be scared about it, but the right technology partner can provide you a solution that works. Next slide, please.
Yeah, I would just comment there, JD, that I've spoken about this in previous webinars, but it's such an important point. Patients just want this. It's one of the top things they request. They want to be able to change their own appointment. They often say things like in their reviews, I want to be, I can book a table or I can book a table at a restaurant easily. I can do lots of things easily. Why is my provider always the hardest? So within the limits of what you can do operationally, just recognize if you want to evolve and to be ahead of the game from a marketing point of view and from a long-term point of view, it's like healthcare consumers want this. It's really something they value.
Yeah, and that open table example is really a good example of the differences in how patients perceive a problem and providers perceive it. Because to the patients, like you said, it's just as simple as open table. But to any of us who have worked in healthcare, we know it's vastly more complicated. And of course, open table, the restaurant down the street, they don't have liability if they accept an appointment for the wrong kind of patient. So
yeah, there's
a lot more going on.
It's for sure a challenge, and the problem is though healthcare consumers don't care.
No, they don't.
They just don't care. I'll share a quick anecdote and I'll let you get back to this. When I was at a conference recently, one of the speakers was talking about the healthcare systems where one of the guys from a healthcare system was dealing with one of the investor groups, and he said, well, as a hospital, we just can't do that. And the investor group said, that's exactly why we're coming in to your space because you can't, we will figure it out. And that's really the truth. It's like
Mhm.
today's consumers want it. They want solutions. So we get that it's hard. We get that there's issues that the consumers don't foresee, but other people will figure it out. And that's really, so Mend has the capability to work within your operational restrictions and still satisfy consumer demands, which I think is great.
Yep. So next slide, please. All right. Adopt automated appointment reminders. Goes hand in hand. Two key things here. One, the reminders themselves. People forget. I forget. I just shared a story about that. Patients in general, they want to be compliant. They want to show up. But a lot of times the care delivery methods we have where we're scheduling months out in advance just aren't realistic. And also, we're not treating patients at their best, with the exception of maybe well checks, which are those scheduled 6 months out in many cases. These are people who are undergoing stress, trauma, they're having severe difficulties in their lives, and stuff gets dropped. So you want to be able to actually remind them, and you want to do it in a relevant way, non-intrusive, but relevant. And you want it to be automated. This goes back to the integration. A good solution can send out those appointment reminders with customized logic based on the appointment types in the EHR. Your staff doesn't have to do anything. They don't have to build a report, upload it to a third-party vendor, wait for it to send. It just happens. They don't have to think about it. That saves you time, drives down your no-shows, makes the patients happy. And once again, relating back to the previous point, if they need to reschedule, can they just click a link and get a reschedule? That's the kind of experience the patients are looking for, and we can deliver it to you in a way that your staff doesn't have to do any more work. Next slide. Reduce patient lead time and improve provider productivity. So once again, just human behavior. If it's going to take 2 weeks to get you in for an appointment, that's a problem for a lot of people. I've had providers tell me it would be 45 days to get seen. And if I ask that provider, well, what's your no-show rate? And they say 15, 20%, and they've got a handful of providers, that means they actually have a lot of slots they could fit me into, but they don't know about it in time. And of course, there's a financial impact to that provider productivity issue. But if you can provide solutions where patients can request an on-demand appointment, they can go into your website and see the next available provider, that's essentially free money for you. You've got a provider sitting in an office not doing anything when someone no-shows. If you have a tool that's going to let you turn that into profitable time, why not leverage it? And just like patient self-scheduling, put guardrails around it. Put business logic around it to where not every appointment type is going to be available. Maybe it's just existing clients. We're not going to let new clients do it. We're going to collect payment at the time of booking, so you don't have to worry about it. Is it going to be the kind of process where if you need an MA to do a pre-screening with a client, can you do that and then easily transfer it to your provider? The technology is there now. We can make this time useful for you, and you're going to get a much better experience from the client.
And JD, just to add to this, doing it from our side, from the marketing side, this is a huge issue. We see it over and over and over again. The data here was 13 days to zero, drop no-show from 52% down to 18. And I see this over and over again. And you mentioned 45 days. That's so common, or even 2 weeks or a week. Patients today, especially as you start developing systems and you start marketing more, patients that are coming from the internet or from marketing don't know you, and so they're going to be a whole lot less patient with you. And what a lot do, unfortunately, is they'll go ahead and accept the appointment 2 weeks out, and they immediately go search for somebody else. And a huge percentage will never even bother to go back and cancel because they found somebody else who was able to get them in faster. So yet again, looking at this from a healthcare consumer point of view will give you a competitive advantage by meeting the consumer's need and building your operation to serve the patient versus starting with the patient's point of view first will give you big advantages in the marketplace.
Yeah, and specifically for behavioral health has the highest no-show rate by all specialties. National average is 37%. And that goes back to the challenges we were talking about earlier that clients face. So that is a huge amount of provider time that's uncompensated. And another aspect that's not unique to behavioral health, but a lot of larger behavioral health organizations have contracts where they're actually being either incentivized or penalized based on how big their wait list is, how long it takes to get clients in for certain lines of services. High risk clients need to be seen within X number of hours in many cases. And so you can utilize on-demand services with just a single click from your website to provide new patient intake, access, open access services, and immediately multiply the number of clients you're actually seeing without having to increase the number of providers. So huge, huge benefit there.
Next slide.
We're in the 21st century. We are close enough to the AIs taking over. We might as well start making them do some work for us before we end up having to work for them. So in healthcare, lots and lots of work with AIs. And it's now actually getting to the point where it's useful for practices, behavioral health specifically, but general practices. We can now, with a 99% certainty, actually predict whether or not a client is going to show up. How are we doing that? Well, we're using several different AI models and over 80 different data points. Some of those data points are, number one, do they have a history of no-shows? Number two, how have they interacted with the systems that we see to know, are they checking their appointment reminders? Are they going in, looking at things? Are they filling out the forms you've sent them? And then we can actually tell you, this client's a high risk for no-show. Would you like to take additional notification steps? And we can actually send additional automated reminders to help get that client there. Once again, if the patient no-shows, that's money you don't make, and it's time that's wasted. So we want to do everything we can to drive it down, and leveraging modern technology, AI, to do that. It's a really smart way to, once again, increase the efficiency of your practice. Expand access to care with telehealth. This is a very broad slide. We're talking both physical, but also to different groups of patients, different populations. So obviously, you can, via telehealth, serve not just the people who can physically get to your clinic, you can serve everybody in your state, and indeed the states your providers are licensed in. So now, say you do have a persistent 30% non-productive time of your providers you're trying to make use of. You can market in new areas where you know there's clients. You can even market to specific clients with specific payer types, so you can improve your payer mix. Say your behavioral health practice is largely state funded, they're maybe getting some Medicaid, and you want to go after specifically either Medicare or insurance clients. You can do that. You don't have to worry about some of the previous physical barriers. Traditionally, private pay, self-pay clients don't necessarily want to sit in the lobby full of self-funded client or state-funded clients. You can offer a top-notch virtual experience to clients anywhere. It doesn't matter who their payer is. It opens up all sorts of worlds of opportunity. From the geographic boundaries, if you're in a rural area and the technology is efficient, and it can actually support internet connectivity in those areas, you now have the opportunity to greatly improve access to those customers. So I mentioned earlier, we've got customers doing IOP. IOP in many places is 3 times a week, 3 hours a session. And if you work and you have to drive any distance at all, well, you're probably not going to be working and making those appointments. It's vital care that now you've made a lot easier for someone to work into your schedule. And we see this in some of our clients on Indian reservations, where it was literally a day-long affair for someone to take off work, pick up their child, and get to the clinic, because it could be a 4-hour commute. So huge possibilities. You're no longer limited by your brick and mortar location.
And JD, it's such a win-win for everybody. So last night, literally, I talked to my kids therapist who relocated from California to Tennessee after hours our time. So, it was convenient for us. This could be, it was convenient for him. We're talking about the issues of my kids, and we know him pretty well. And his practice, he loves being able to practice, remotely. And, providers want it, the patients want it. I think it's another thing you mentioned earlier, when we're working with behavioral health, the whole private pay versus public funded insurance is a huge issue just about for every practice we work with. And particularly, you actually alluded to this, where there's a time where in the physical world, a practice can actually tip to where it's being known as a Medicaid practice. And so it's very difficult to get out of that. And so it just opens up a world of possibilities. And I think the whole idea of languages, we are in such an ethnic country. It's like, we've always had the melting pot since the earliest days, right? If we learned that in school, but now it's rather than a melting pot, it's kind of like a fruit salad. There's all kinds of languages and different needs out there, and then setting people up with the right provider and based on personality or profile, or maybe you have somebody who's really good with depression. But the possibilities are endless. And that's why, I look at this as starting from scratch. And this is something that's, if you look at historically, some of the biggest winners are the ones that can understand the implications of a new technology and figure out what it enables that you previously could not do, and really leverage that. So it's, telehealth, okay. But if you really sat down and thought, especially if you have a multi-location business, strategically, what does this permit us to do uniquely better than anybody else has ever done before? That's where some of the magic is.
Yep, absolutely. And I can't believe I forgot the point about languages, but you're absolutely right. And it's amazing finding out in my role on the sales side, seeing clients come in and they say, hey, we've got 60% of our clients speak Nepali. Can you support that? I'm thinking, Nepali, how did that even happen? And then they tell you some story about how there was this large migration in the 60s or 70s, and it's fascinating. And then being able to say, yes, we can provide those notifications automatically in Nepali. We can translate the UI. We can give you the tools you need to actually serve that community. It feels great from a technology vendor standpoint, and from the provider side, they're getting a tool they desperately need, and that not a lot of other people are going to be able to deliver on.
Okay, next slide.
So expand hours and provide convenience with telehealth. This kind of goes along with the geographic boundaries, the time boundaries. So 9-to-5 practices are closed 80% of the time. Now, not everybody's going to be able to run a practice for 24 hours, but think about restaurants. We've talked about them once already. How successful would restaurants be if they were closed or they worked 9 to 5? They'd get the lunch rush, and that's it. People exist outside of 9 to 5. And it's with technology, with telehealth, it's easier now to expand your practice to say 8 o'clock and open maybe at 7 a.m. than it ever was before. We talked a little bit about provider burnout earlier. A flip side of that is that with telehealth, you can now contract with more providers than you ever did before. And they don't need to be full-time providers. You can have part-time providers who handle just the afternoons because maybe they want a second job and some additional income. And they don't live anywhere near you. If you're in Orlando, they might live in Miami, but you've now got a pool of providers you can use to expand your hours and provide services to a whole nother group of customers, or just your existing customers on a schedule that they want to see. That's going to improve patient satisfaction, and it's going to radically improve the amount of patients that are actually coming through your practice. Some of the other bullet points: blue collar workers can't get away during working hours. In behavioral health, we see a lot of clients who might be child welfare dependency clients, and they might be court ordered to maintain a full-time job. And guess what? If you're pulling them away from that full-time job for, say, IOP or even family therapy once a week, now they've got two demands on them that can't coexist in most worlds. So just being able to offer that family therapy at, say, 6 o'clock is going to be a huge benefit to your clients.
Well, and JD, one of the things that, everybody likes private pay patients, and the ones that are, the sort of classic, family, upscale, female, head of the household, 40 to 60, right? That's kind of like the classic behavioral health target. So everybody likes telehealth, but that target audience demands it.
Yeah.
So that's a big difference. Again, if you're trying to be market friendly, I would just think about, as things change, and plus as they become more and more accustomed, you saw 80-something% want to do this in the future. If you can't figure out how to deliver this, somebody else will.
Absolutely.
Just a cold reality. Sorry, but it's the truth. Next slide, please.
Embrace digital intake forms. So this is another one of my soapbox issues. In the world of telehealth, everybody talks about video. Sometimes they talk about remote patient monitoring, but most of the time they're talking about video. That's the glamorous piece of the technology that gets all the attention. And in many ways, it's actually the simplest part of the technology. As we've talked about, Stewart, the video portion's been around for 20 plus years. The ability to collect the data that is required by your regulators and your payers from the clients in a simple, fast, easy way, that's where the rubber hits the road. Because if you just add a video conferencing platform like Zoom or Teams into your existing workflows, all you've done is made more work just by moving where the patient is. If your solution actually allows the patient, as part of the natural experience of going through their visit, to conduct the paperwork, to do the intake, you're going to see a much better satisfaction rate from the clients. But from an operational standpoint, much more importantly, you're going to see a vast reduction in the amount of support staff necessary to get all this stuff done. A story I like to tell is one of our clients, they fortuitously adopted Mend in October 2019. And they were slowly trickling providers into the system. They'd had several failed technology vendors that they had worked with. And of course, COVID hit. They had to transition to 100% digital workflow over March of 2020. And they also lost half their front desk staff. The front desk staff said, we're going to take the enhanced unemployment. We're not coming in. Best of luck. See y'all later. But because they had adopted Mend's digital intake forms and were now able to do things like sliding scale fee assessments, financial affidavits, consent to treat, psychotropic med releases, some really complex forms that required multiple signatories. Because they could do that easily, they actually didn't have to hire back any of those staff. They were able to actually cut their front desk staff by 50% and support a actually higher visit count, because they actually saw their no-show rate plummet at the same time. So they were seeing more patients at a more productive rate using fewer staff. And paperwork was really one of the keys there. And we talked about integration. The dream with digital paperwork is it gets automatically assigned out of the EHR, no additional work by staff. So if you're booking, say, a follow-up psychiatric appointment, any of the forms that are required to go with that are going to get assigned automatically. a system that is intuitive and easy to use like Mend is going to get 80% of those 86% of those forms back prior to the time of service, and they're going to get 60% back within an hour. And that's going to automatically go back to your EHR. That is a huge, huge time savings. And then, of course, getting this data helps with both compliance and billing. No one likes denied claims. Everyone wants to get paid for the services they've done. So it may not be glamorous, but it is a huge benefit to your practice. All right, strategy 9, embrace all the opportunities telehealth platforms can provide. Like you mentioned earlier, figuring out how to use these tools before your competition is going to be a huge benefit to you. So a few bullet points that we brought out. Make sure the patient engagement tools support the model of care that you're working on. We haven't mentioned it, but the same tools that you're leveraging for telehealth when it comes to appointment reminders and reschedules, automated self-scheduling, all that can apply to your in-person reminders as well. There's no need to have 2 different systems for that. Can the system automatically enable all those tools? Can the business logic support everything you need? Promote your telehealth options to both your current patients and your community. So a big part of success in telehealth is actually letting your patients know about it, and more importantly, letting the patients you want, your target patients, the ones you want to grow your practice, know about it, and merging it into your current marketing efforts, merging it into the leads that are coming into your website, directing them into that patient registration, then self-scheduling system, and essentially converting leads into actual patients and getting the ones you need. Like we mentioned earlier, payer mix, going after those private pay clients. Use telehealth to more easily match patients to your most appropriate providers. Once again, this kind of goes hand in hand with that self-scheduling workflow. Does the tool you're going to use for self-scheduling actually let the patients go to where you want them to go? Is it going to ask them questions in a consumer-friendly way that's going to give them the information they need to get to the right place? And the tools are there. We just need to adopt them.
Very good. Next slide.
So
JD, I'd like actually you to speak to this. I just would talk about it from a consumer point of view. You know, as a agency, we work with lots of technologies, and this is a key point that as we wrap up here, it's just every time I work with a new technology, the tech support is really crucial. And we've talked offline about the importance of tech support, but do you find your providers feel it's the same thing, that the tech support is important? Is that something that you guys can provide?
It is the #1 overlooked pain point. And yes, Mend provides full tech support. And the 2 things to think about with this: if you're providing tech support, who is providing it? A lot of times the answer, unfortunately, is the provider. That's your most expensive staff time and the person potentially least equipped to actually handle the technical issues for the client. 2, if you're having your IT team do it, do they have the tools necessary to actually quickly and easily help the client? And in either scenario, what is the cost to you? Having a telehealth tool that offers full support both for your providers and the patients is a massive, massive game changer. And when you see that your providers are just having patients pop into visits and that you don't have to walk them through turning on their camera or getting things set up, you're going to see both patient satisfaction and critically provider satisfaction improve.
Very good. So I think we're at last question, because as we wrap up now. By the way, we are going to be taking Q&A in just about 2 minutes. If you could do us a favor here, JD, give the sort of commercial for Mend, for both this slide here and the next one, help people understand why Mend, and then we'll get straight into the Q&A.
Absolutely. So Mend is a full-featured patient engagement platform. We're built around telehealth, but we handle everything necessary for your practice to interact with your clients in the digital space. We want to be your digital front door. So forms, appointment reminders, payment capture, text messaging, we can do that. And we integrate with your EHR so that there is as little additional work necessary on your part as possible. In fact, the dream is to radically reduce the amount of work you have to do. And we've done this for over 400 clients, 400 providers so far. We're conducting over 400,000 video visits a month. And we would love to talk to you about how we can help your practice.
Outstanding. Very good. Great job, JD. So we have a bunch of questions coming in. I encourage you, if you do have questions, we have time. We've got about 13 minutes left here to take your questions. I've got 4 or 5 already. So I'll start with some of the questions we have, and we'll see if you get some additional questions as we move forward. And again, of course, if you're interested in Mend, you can contact our good friends over at Mend and talk to them about your specific situation. And I'm going to go ahead and read off some of the questions. And JD, you're the expert; you can answer them. I'm the marketing agency owner, not the telehealth expert. So the first question that came in just now was, what EHRs do you guys integrate with over at Mend?
We integrate with over 88 EHRs currently, and we can integrate with most any EHR out there. We just need to investigate it. If you have one that you think no one can integrate with, you might be right. There might be a chance no one can integrate with it, but there's also a good chance that we have tools you haven't run across before.
Outstanding. Another question, again, as a business owner, these are the questions I would ask. Okay, great, I like this, but how long does implementation take? I've got a lot of moving parts in my business. What should I expect?
And the answer to that is it depends. We can stand up a standalone practice in a non-integrated workflow in as little as a week. If you have say you're a hospital and you have a very complex EHR like Epic, where you're looking at multiple different integrations with different systems across different product lines, you could realistically be looking at 3 to 6 months for the fully integrated workflow. But we'll work with your team to figure out what your priorities are and come up with a customized implementation plan that meets your deadlines and your needs. And hopefully we'll be able to mutually succeed.
All right, outstanding. Let's see here. The next question. This is a pretty common one. Do you guys also have providers on staff, or are you like Teledoc, or are you strictly a technology company?
We do not. We are strictly a technology company. So we want to give you the tools to make your providers as successful as possible.
Another real world question I see a lot. How do you get staff to buy in? I mean, like we talked about earlier, sometimes providers aren't always jumping in line to try new things. So what are some of the best practices to get staff buy-in?
You're absolutely right. This is one of the biggest issues, and I've seen companies succeed tremendously and fail tremendously, all on staff buy-in. And I think the number one key is communication up front. Make sure they understand why you're going in this direction. Number 2, they understand that you are going in this direction. It's a real thing. It's not a initiative that's going to fall by the wayside. And I think 3, you want to make them understand that this is going to make their lives easier, and actually pull in provider champions as early as possible. Basically help create super users and champions within the programs. And that way, number 1, as you're going through the implementation process, these champions are going to let you know and let us know if there's a problem early so we can fix it. And as we're actually adopting their suggestions, they're going to go share that back with their colleagues. And that's, I think, really going to pay dividends in the buy-in area.
Okay, we've got a couple more questions. If you have additional questions, please text them into us as we get close to wrapping up here. What makes Mend different from Zoom or Teams?
Those 2 platforms are simply a video conferencing platform. So they are great at the video, And in fact, Mend can even integrate with them to take advantage of some of their special features, but they don't handle any of the patient engagement tools. And they're going to actually, if you just stand them up by themselves, that they create more work, because now you've got to figure out how are you going to schedule within Mend or Teams, or I should say Zoom or Teams. The EHR is not going to talk to these systems. So someone's going to have to put those appointments in, or you're going to have to send the patient an invite immediately before the session, or even worse, you're going to have a nurse, which is the way my primary care provider was doing it, send the link out half an hour ahead of time, jump in the session with the patient, make sure their technology is working, then let the provider in. And you've now wasted a bunch of very expensive staff time that could be better served doing something else. So the bottom line is they're not optimized for healthcare workflows. They don't do anything to help you get all the other parts of your business done. They just do the video.
Very good. And we just had a question. It's interesting if you have a question, feel free to use the chat box. You don't need to text us. You can just simply chat questions into the platform and we can take more questions. Another question we have is, you guys alluded earlier to both virtual and in-person care. How does your system and workflows, have you been successful in managing both of those things?
Oh, absolutely. And, once you've built the integration, you might as well leverage it for everything you can. And from a data standpoint, the only difference between an in-person and a virtual visit is a couple data elements and how the system recognizes the visits, and then the logic that we set to conduct the reminders and scheduling, that kind of thing. So if you're going to integrate, do it for everything, build it up front and take full advantage of it, because people forget for in-person just like they do for virtual. So leverage it wherever you can.
Great. I just got another one. We talked about support, JD, and we talked about this being important. So the question is, what support channels do you guys offer for clients after the sale?
Every screen in our application, both on mobile and on desktop, for providers, staff, and patients, has a need help button. That need help button is staffed by Mend employees located in the United States, and they're available from 8 a.m. to 11 p.m. Monday through Friday, 9 to 6 on Saturday, and Sunday they're on call. And they respond in an average of 15 seconds, and the time to resolution on average is 3 minutes. So wherever you are, you're available. Help is there, and we're going to get you the help you need.
Fantastic. And time for a couple more questions. I've got one or two left. Let's see. The last one I have currently is, can group telehealth sessions be secure and HIPAA compliant?
Absolutely. Mend, we're doing lots of group already. As I mentioned, we're doing IOP groups. We actually, through various different technology tools, we can support pretty much any kind of group scenario you can throw at us. And especially in behavioral health, group is really a critical part of the process, because of course, we do a lot of groups in behavioral health. It's a great tool to improve revenue, because you can have, of course, multiple paying clients for the same number of staff. And the tools that are able to support those workflows are really, really beneficial. And as I mentioned earlier with Teams versus Zoom, yeah, they can do the group video portion, but are they going to be able to send unique HIPAA compliant links to all the participants? Are they going to be sending those appointment reminders? Are they going to let them reschedule those appointments? Those are the considerations you want to keep in mind.
All right, excellent. It looks like that was our last question for the day. If you have additional questions, I recommend you just go ahead and email jd@mend.com. That was a really difficult to remember email address there, JD. So jd@mend.com. Feel free to reach out to him as well on any of these types of issues regarding Mend and telehealth, and he'll point you in the right direction. I want to thank everyone for joining us today. I've really enjoyed it. JD, great job as always. And we appreciate your attendance. And JD, thank you for leading the session today.
All right. Thank you, everybody. Have a great week.
All right. Take care.